Bacterial diseases in livestock. These diseases are often invisible to the naked eye, yet they can wreak havoc on a farm, affecting the health and productivity of livestock. Healthy animals are the backbone of a good farm. They ensure a steady supply of milk, meat, and other products that are essential for our daily lives. We all want healthy animals. They are not just a source of income, but also a part of the family for many farmers. But tiny enemies we can't even see can cause big problems. These microscopic invaders can lead to severe health issues in livestock, causing stress and financial loss for farmers. Bacteria are so small, you need a microscope to see them. Despite their size, they can multiply rapidly and spread through a herd, leading to outbreaks of disease. They can make our animals very sick. Symptoms can range from mild discomfort to severe illness, and in some cases, they can be life-threatening. Sometimes they can even infect people. Zoonotic diseases, which are transmitted from animals to humans, pose a significant risk to public health. These diseases can make animals stop growing. They can lead to weight loss, poor growth rates, and reduced feed efficiency, impacting the overall productivity of the farm. They can stop producing milk or eggs. This not only affects the farmer's income, but also the availability of these essential products in the market. In the worst cases, they can be fatal. Losing animals to bacterial diseases can be devastating, both emotionally and financially for farmers. This essay will help you learn about common bacterial diseases in livestock. Understanding these diseases is the first step in managing and preventing them. You will learn how to spot them and how to prevent them. Early detection and prompt treatment are crucial in minimizing the impact of these diseases. Knowing about these diseases helps you protect your animals. Regular health checks, proper hygiene, and timely vaccinations can go a long way in keeping your livestock healthy. It also helps you protect yourself from infection. By following biosecurity measures, you can reduce the risk of zoonotic diseases and ensure a safe environment for both animals and humans. Let's work together to keep our animals healthy and productive. A healthy farm is a happy farm, and it all starts with understanding and preventing bacterial diseases in livestock. Anthrax, a deadly threat. This disease has been a cause of concern for farmers and veterinarians alike for many years. Anthrax is a very serious disease that can have devastating effects on livestock and, consequently, on the livelihood of farmers. It is caused by the bacteria called Bacillus anthracis, which is highly resilient and can survive in harsh conditions. This bacteria can live in the soil for many years, making it a persistent threat to animals that graze on contaminated land. Animals can get anthrax by eating contaminated feed, which can happen if the soil they graze on is infected. They can also get it by breathing in the spores, especially in dusty and windy conditions where the spores can be easily inhaled. Anthrax can kill cattle, sheep, goats, and other animals very quickly, often within a matter of hours. Signs of anthrax include high fever, bleeding from various body openings, and convulsions, which can be distressing to witness. Sadly, animals often die suddenly before showing any signs, making it difficult for farmers to take preventive measures in time. There are vaccines available to protect your animals from anthrax, which can significantly reduce the risk of an outbreak on your farm. Talk to your veterinarian about vaccination schedules and the best practices to keep your livestock safe. If you think an animal might have anthrax, call your veterinarian immediately. Quick action can help prevent the spread of this deadly disease and save the rest of your herd. Brucellosis, affecting both animals and humans. Brucellosis is a disease that can infect both animals and humans. It is a zoonotic infection, meaning it can be transmitted from animals to people. It is caused by bacteria in the Brucella family. These bacteria are highly contagious and can survive in the environment for long periods. It spreads through contact with infected animals or their fluids, such as blood, urine, and milk. Farmers, veterinarians, and slaughterhouse workers are at higher risk. Animals with brucellosis may abort their pregnancies, leading to significant economic losses for farmers. This can be particularly devastating during calving season. They may have swollen joints or develop a fever, which can severely impact their health and productivity. Other symptoms include lethargy and loss of appetite. Brucellosis can be difficult to diagnose because its symptoms are similar to other diseases. This often leads to delays in treatment. blood tests are used to confirm the diagnosis. These tests detect antibodies against the Brucella bacteria in the animal's blood. Treatment for brucellosis is often prolonged and not always successful. It usually involves antibiotics, but the bacteria can be resistant. Vaccination is the best way to prevent brucellosis. Regular vaccination programs can help control the spread of the disease and protect both animals and humans. Blackleg, a soil-borne killer. Blackleg is a deadly disease that affects young cattle and sheep. It is caused by the bacteria which lives in the soil. Animals get infected when they eat contaminated feed or soil. Blackleg causes muscle swelling and lameness. Affected animals may have a high fever and die quickly. Treatment is often unsuccessful once symptoms appear. Vaccination is highly effective in preventing blackleg. Talk to your veterinarian about vaccinating young animals. Leptospirosis is a bacterial disease that spreads through the urine of infected animals. It is caused by bacteria in the genus. Animals get infected by drinking contaminated water. Leptospirosis can cause fever, jaundice, and kidney failure. It can also lead to abortions in pregnant animals. Antibiotics can be used to treat leptospirosis. Vaccination is available to protect animals from the most common strains. Providing clean water sources is essential for prevention. Mastitis is an inflammation of the udder that affects dairy cows. It is often caused by bacterial infections. Bacteria enter the udder through the teat opening. Mastitis causes the udder to become swollen, red, and painful. Milk from infected cows may contain clots or pus. Antibiotics are used to treat bacterial mastitis. Good hygiene practices during milking are crucial for prevention. This includes washing hands and cleaning teats before and after milking. Salmonellosis is a food-borne illness that can affect both animals and humans. It is caused by bacteria in the genus. Animals get infected by eating or drinking contaminated food or water. Salmonellosis can cause diarrhea, fever, and abdominal cramps in animals. Young animals are particularly susceptible. Antibiotics may be necessary to treat severe cases. Good hygiene and biosecurity measures are essential for prevention. This includes cleaning and disinfecting animal housing regularly. Pneumonia, a respiratory challenge. Pneumonia is an inflammation of the lungs that can be caused by bacteria, viruses, or other agents. Bacterial pneumonia in livestock is often caused by animals with pneumonia have difficulty breathing. They may cough, have a fever, and lose their appetite. Antibiotics are used to treat bacterial pneumonia. Providing good ventilation in animal housing is important for prevention. Reducing stress also helps prevent respiratory diseases. Foot rot, a painful condition. Foot rot is a painful condition that affects the feet of cattle, sheep, and goats. It is caused by bacteria that thrive in wet and muddy conditions. Foot rot causes lameness and swelling of the foot. Affected animals may be reluctant to walk. Treatment involves cleaning the affected foot and applying antibiotics. Providing dry and clean bedding can help prevent foot rot. Regular hoof trimming is also important. Preventing bacterial diseases, a shared responsibility. Preventing bacterial diseases in livestock is a shared responsibility. Farmers, veterinarians, and everyone involved in animal care play a role. Vaccination is one of the most effective ways to prevent bacterial diseases. Vaccines help animals develop immunity to specific diseases. Good hygiene practices are essential. This includes cleaning and disinfecting animal housing regularly, providing clean water, and practicing good biosecurity. Early detection saves lives. Early detection of bacterial diseases is crucial for successful treatment and prevention of spread. Farmers and animal caretakers should be vigilant in monitoring their animals for any signs of illness. If you notice any unusual signs, contact your veterinarian immediately. Early intervention can make a big difference in the outcome. Remember, healthy animals mean a healthy farm and a healthy community. Let's work together to keep our animals healthy and productive.